Infant and early childhood mental health, sometimes called early relational health, is a field that touches many aspects of public policy, early education, public services, the justice system, infrastructure. The list goes on. It may be tempting to think of infant and early childhood mental health as one specific service or, as we often do with mental health, as merely the opposite or absence of mental health. But it's so much more than that. Infant and early childhood mental health is the process by which children learn to explore their environment, regulate emotions, and form relationships with others. In other words, it's brain building. A child's well-being is like a scale with two sides, one end with positive experiences and another with negative experiences. Supportive relationships with adults, sound nutrition, and quality early learning are all stacked on the positive side. Stressors such as witnessing violence, neglect, food insecurity, or homelessness are stacked on the other. To achieve positive child outcomes, we can pile positive experiences to tip the positive side and offload weights from the negative side. Science is clear. Children's futures can be undermined when environmental stressors interfere with early brain development. But the good news is that potentially toxic stressors can be made tolerable if children have access to stable, responsive adults, parents and caregivers, home visitors, child care providers, teachers, and other supports. Did you know? Tennessee's infant and early childhood mental health system has become a leader in the nation, with the Association for Infant Mental Health in Tennessee at the center and featuring partners like the ones you see on your screen now and in the following video segment.
RIP really taught me to be the change that I want to see. So if I want my son to respond positively to a negative situation, then I have to model that behavior.
RIP is an early childhood behavioral health program. We work with children 2 to 6 and their families who are struggling with behaviors.
For parents like Christan Riley, the regional intervention program helped to strengthen her relationship with all her children. But for her son Kellie, RIP was a game changer.
He suffers from ADHD and autism. I think I was just desperate, for anything that I could find to help me. So I was hopeful. I didn't have any doubt that it would help. I wasn't sure how much it would help, but I was hopeful that it would help.
A few years later, and Christan says they're both changed people.
I learned to be a better parent. I learned to use more positive reinforcements instead of negative reinforcements. That was the biggest takeaway for me.
We coach families on ways to teach their children those social emotional skills that will carry them through life. We don't have any diagnosis requirement, anything like that. All families are welcome here at RIP. It's entirely free. We require no referral, just the parent to call us and say, this is what I'm looking for.
I feel like I benefited even more than my son did because I didn't have the most positive examples of parenting growing up.
In Columbia, Tennessee, new mom Taylor Shelby has settled into her role as a home visitor with Centerstone.
Because I'm passionate about it. I know the impact that it had for me. And so I want to bring that to the table for each client or parent that I meet.
2 years ago, she welcomed her first baby, Charlotte, into the world.
I cannot stress enough how valuable the relationship that I built with my home visitor was. Being a new mom, not really having a lot of experience with babies before her, just having somebody to navigate that with, providing me education on my daughter's development that was relevant for the time that I was going through. I also suffered from postpartum depression and anxiety, and she kind of pointed me in the right direction in terms of that, but just the conversations that we had, the support each week, I was feeling alone at the time, and having somebody there sitting with me or talking to me about my baby and reconnecting me with my baby really just like motivated me to be the best parent that I could be.
Taylor says her home visitor played a crucial role in her and her baby's mental health. Now she's paying it forward.
And I ended up getting a job to be a home visitor and turn around and help moms in the way that my home visitor helped me. So I've seen moms that started in this program that were in a women's shelter and now they've got their own place, they've got a car, their kids are super happy, they're happy when I'm talking to them on the phone. It's just, I don't know, enough can't be said about how much this program and programs like these can impact people that might not have the support in there or may not know that there's support out there for them.
Home visitors are an important part of a baby's development and benefits families in every region of the state, including West Tennessee, where the Early Success Coalition works to make those important connections.
The Early Success Coalition is a collective impact initiative that is really a group effort of over 60 agencies in the community who are working with children prenatal to 5 and their families. We operate a No Wrong Door portal where community partners can refer people into the home visiting programs. It's really just a one-stop shop for home visiting because we have 5 amazing programs in Shelby County. They all have fantastic outcomes. They're all great programs. There are, slightly different focuses, slightly different requirements. So it can be a little bit tricky to try and navigate which one is the right one for you. So we try and make that process as streamlined and as easy as possible. We were just able to expand home visiting to every county in Tennessee, which is incredible. Not a lot of states can say that.
Headquartered in East Tennessee, the Child Care Resource and Referral Network works directly with educators to make sure families have access to the best resources available.
The Child Care Resource and Referral Network provides professional development training for early childhood educators across the state. When we think about how the CCR&R fits into the conversation around infant mental health, it really comes down to how we work with our early childhood educators to make sure that they have the skills that they need as well as the resources to help the children in their classroom. We want to make sure that they can recognize stress within themselves and that they take time for self-care. We also want to make sure that they have the materials and information that they need so that they can recognize developmentally appropriate practices for infants and toddlers that are in their care. We know that by having a coach who can work with them side by side and mentor with them, they're going to have the confidence that they need and know that they have the skills and the ability to make sure that the children in their care have everything that they need to have a strong foundation as they move from their infancy up through preschool and into the school age. For the CCR&R, it's really important that we make sure educators have the resources that they need. If we don't have those resources handy, we do have partnerships across the state where we can refer our educators. One of those partners is the Association of Infant Mental Health of Tennessee, and they've done a great job of pulling together infant mental health resources that are available on our website. These resources that are on our website are organized by county, which makes it really easy for families and educators to find what is located closest to them. One of the things that I think is really important as we move forward and we think about the needs of our infant toddlers is that we make sure that we have policy in place that considers their needs as well. We oftentimes really focus on our kindergarten through 3rd grade or kindergarten through high school, but it's really important that we think about the 0 to 3 age range and understand and realize that most of our development is happening there, and anything that we can do within our state to make sure that that is recognized is going to really not only benefit the children, but the families of our state. It's going to be really important that we make sure that we have an infrastructure that is addressing infant mental health. We need to make sure that we have supports for our infants and toddler teachers and that we have quality classrooms for our infants and toddlers to attend. Because of the pandemic, our children are starting life under stress. It is vital that we have supports now so we can build a stronger future.
Back in Middle Tennessee, Maria Burkeen and her daughter Amelia are in their 3rd year of the Head Start program.
Whenever we found out that she had severe hearing loss and everything that it had to offer here, we decided it was best for her to go ahead and get started. It was very, very overwhelming. It was, I was a new mom. I was new to the whole world. And then to find that kind of information out, it was scary. It was I didn't know my left from my right. I didn't know what was best for her, and I felt lost there for a little while.
She says the Head Start program helped to get her feet back under her.
They have helped me in so many ways. They have been able to step up when I was having to work. Like all the stuff that I didn't understand, they took the time to help me. They have rearranged classes to just accommodate her needs. They have started teaching sign language with all the students to help her and help her fit in and help her learn how to, I guess, communicate with other children. It took a load off of me. It changed my life. I've been able to breathe. I've been able to take a breath and take a step back and really figure out what the right direction is to go with her and what the right solutions are to help her and what's going to help her move forward and help me too, because they, offer help for parents, and it's amazing. It's crazy. It's hard to explain how helpful it's been and the difference in how I feel and the confidence I have in being her mother, I guess, in a way, and knowing what I need to do for her.
Tennessee has an established track record for cooperation among state agencies and between public and private sectors. This provides a great foundation on which to build an even better infant and early childhood mental health system, one that embraces a statewide, no wrong door approach. Implementation requires the right blend of cooperation, forward-thinking policies, and technology, but the benefits are worth the effort. No Wrong Door is a people-centered solution for human services that provides a universal gateway to community and government programs. The concept is simple. Any point of the system is an entry point. For example, imagine a single application that families can use to determine eligibility for and enroll in the programs mentioned in this video, as well as other state and community-based resources. Of course, infant and early childhood mental health is more than a litany of programs and policies. It's a way of seeing the world, a way of seeing public policy. Every decision we make as a community, a state, or a country is an opportunity to ask, how does this affect developing brains? How will this impact children and families? How does this impact the developing brains of our future workers, caregivers, our leaders? As we ask ourselves these questions, there is no need to try to find the answers on our own. All the infant and early childhood mental health professionals featured in this video are here to help policymakers make informed decisions. Thank you for watching.